Sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in today. Well, we're going to wrap it up on the subject of constipation, more on the subject than you've ever heard before, I'm sure, and more to come. Now, I've got a number of questions that I'm going to be posing to the good Professor Konstantine Monastyrsky. But today's the day, too. If you have a question and you want to jump in front, give us a knock on the door. I'll let you immediately in the store, and I'm sure that our guest today, expert as he is in all things gastrointestinal, Konstantine Monastyrsky, will be able to answer it. So we'll be discussing the issue of constipation today. If you have issues with it, hopefully you've been able to learn a lot about how to prevent it and what not to use to correct it. Hopefully you understand by now, fiber ain't the way to go. Thank you, Professor Konstantine Monastyrsky. He's our featured guest today. And in the course of our discussions, as we have already stated, if you'd like to call up and ask your own question, the number to do so is 412-825-6262. That's 412-825-6262. Constipation, Part 2. A little ring to it, doesn't it? Okay. Now, the way the schedule shapes up from this point forward on Friday, yes, we are going to open it up to anything on your mind. It is a open phone Friday. It is a get 'em up out of town version of the show. In the purest sense of the word, it's been about a month since we had the opportunity to do that last, and I'm looking forward to it for you on with you on Friday. We'll then be turning the page on Friday. It is the last day of the month. I think the temperatures are going to be more seasonal. Yes, its time has come. And anyway, on a return on Monday, Faye Houston's going to be with us. She was with us once before. She's written a book about her own personal crisis and resolution of that crisis, spanning multiple years of her life. She entitled her book, Silent Enemy, Environmental Illness, and the One Woman's Search for a Cure. And she, well, you'll be happy to hear, actually found that cure. But what she did in order to find it, she's tried every single alternative measure that I know of, and some I had never heard of. Anyway, she'll be our guest on Monday. You'll enjoy being and spending some time with her. Then on Wednesday, Dr. Vava Vavoom returns. Going to be talking about weight loss. This will be a parlay that we couple right on the back of her webinar, which she did on the 16th. Anyway, it's our first opportunity to be with her since the webinar. We'll be sharing things with you with respect to the weight loss from her perspective. Then we move to the 14th of October. Dr. David Brownstein is going to return. Of course, you know him very well here in Pittsburgh. All things that were iodine were originally tomed by him. Then a great book on thyroid. We've covered that on a couple of occasions. We went then to his book on salt, Salting Your Way to Health, and now his newest one. Now this is his 10th book. So we got an opportunity to go backtracking, and we'll cover them all before the year's up. And we're going to talk about his new one entitled The Soy Deception. That's Dr. David Brownstein on the 14th. Other guests, as they do schedule, I'll bring them to your attention, will be filling up October rather quickly, I'm sure. Now, don't forget, RTD dressings available here if you are a diabetic especially. and you need to have protection with respect to any wound that you may get, a paper cut turns out to be a big problem for a diabetic, especially a paper cut in the fingers or the feet. I wonder why you get a paper cut in the foot. I don't know. But certainly in the fingers. This is not good. You need to have, if you're a diabetic especially, the ability to apply a dressing that has a therapeutic component, not just a barrier to infection. RTD dressings available here. I think they're not available any other place in western Pennsylvania other than operating room, supply rooms to various hospitals in the area. But that's it. Not available on the retail market. We have them here. Also, our oils, boy, if we haven't made enough of a splash, so to speak, when it comes to how you replace your fatty acids, with respect to presenting you with Ed Kane, and then the Professor Brian Peskin last week. Yes, the oils are here. They're in their parent form. They're in their organic parent form, and they're in the ratio of 4:1 omega-6s to omega-3s. That's linoleic to alpha-linolenic. The linoleic component, sunflower, safflower, primrose. The alpha-linolenic component, flaxseed. Also like the idea, although it's not contained in this particular product, chia seeds. That little thing on the windowsill. Driving me crazy. Evidently is a great parent oil to be able to get your hands on. Never seen it. Purchasable, but that little thing on the windowsill has a big payoff to it. Then, of course, F3, the all-inclusive supplement, rather than buying 6 of them. You can get 6 wrapped up in one in an organic form that is fully assimilatable. You will get everything that you consume will get into the bloodstream. The product from BioAge, the work of another Soviet, Dr. Michael Kiriak, who has actually been on the show, and hopefully we'll get him back too. So that's the way that shapes up, and we'll let it go at that. Let's do this. Let's, without even waiting another moment, take a short break. And in that interim, I'm going to go find our good friend near New York City. He is the most knowledgeable person I know in all things GI, gastrointestinal that is, and particularly in the colon. We're talking about constipation, folks. The Constipation Part 2 resumes on our return. Be right back with Konstantine Monastyrsky.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Honey, just got the word. The company's new health plan has a $5,000 deductible. We have to make sure nobody gets sick this year. Remember what those doctor's visits cost for last year's colds and flu? Well, sorry, I've got to go. Love you.
We can do this. We can cut the fast food lunches. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit. Fruit of the spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruits with herbs and minerals. We could add some to our breakfast protein shake. Fruit of the Spirit is unique whole fruit puree. Fruit of the Spirit contains fresh fruits native to the Holy Land and alkalizing minerals from the Dead Sea. With no added sugars, Fruit of the Spirit is a unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. heard here on a Wednesday morning version of the show. It is a part 2 for us. Part 1 we kicked off on Monday with a gentleman we've come to appreciate as being quite knowledgeable with respect to all things gastrointestinal. Now, the culprit he's already pointed to. Fiber is harmful to you folks. You got to watch it in terms of, at least if you're counting it. If it's just coming to you naturally, maybe not a problem, but boy, can it gum things up. What it may lead to is what we're talking about today, and we started on Monday. The issue of constipation is a big item. Our guest today knows an awful lot about it, and we're going to go through a litany of questions and pose them to the good professor, I'll call him professor, and see if we can accomplish our goal today to get through them all. You too can give us a call today, 412-825-6262. I now bring to you Konstantine Monastyrsky. Konstantine, welcome aboard. Thanks for coming back again.
Thank you, Dr. Courtney. Good morning, everybody.
Konstantine, I did have that right with respect to fiber, the role that fiber plays in kicking off literally every doggone GI dysfunction, disorder, and malady that I think a medical book could offer you. They're just all there. It doesn't mean that each one of the diseases that you could read about in the gastrointestinal system is caused by fiber, but in any case, it could lead to every single disease. Fiber is the culprit. Spend a moment, even though we're going to go to the constipation issue, discuss in brevity that role that fiber plays in all these problems.
And that is correct, Dr. Courtney. Amazingly, fiber is, well, not amazingly actually, in reality, fiber is indigestible substance. And our colon, the colon doesn't really tolerate, or even small intestine, the small intestine doesn't tolerate anything that doesn't digest. I mean, it's unnatural for human beings to consume something that wouldn't digest. If long time ago, now those tests are no longer popular, but long time ago, and you probably remember this well, the stool exam was quite common. And what was the first thing people were looking in a stool exam? Undigested fats, undigested proteins, and undigested carbohydrates. And if a doctor or lab could find something like that undigested, they would say, oh gosh, you really have a problem. It might be assimilation problem. It may be a problem of not digesting the substance perfectly in your stomach, or you may have deficiency of certain enzymes and gastric juice to digest. And people were recommended a lot of remedies, taking hydrochloric acids, taking natural or artificial enzymes, going to mineral water resorts to improve their digestion and so forth and so on, chewing better, paying attention to food, not eating while watching television, not fighting with your spouse while eating, not drinking too much alcohol, not drinking too much fluid. This was a standing advice. And avoiding fiber because it was undigestible. Then about 25, 30 years ago, several enterprising companies found out that they can purchase for pennies on a dollar, for pennies essentially, for pounds, penny per pound, a stock feed, and mill it very thoroughly, add it to food, and claim that bran in foods will, particularly in baked goods and pasta and cereals, will add value to your health because it will improve your regularity and will fight constipation, and the substance was fiber. So now, while throughout the entire development of human race, we were avoiding fiber, now suddenly it became a health food. And obviously, anytime you go to a health food store, you probably notice everything is twice as expensive. So it was a very profitable racket, and this racket continues until this day. And so people are consuming fiber with the belief it's very good for them. But if you go to any book on gastroenterology, functional diseases or organic diseases, organic and irreversible functionals that are reversible by changing your diet, you will find out that there isn't any proof that this is a theory, hypothesis. Nobody actually ever proved that fiber is healthy for people. And the reason why fiber isn't healthy, because when it finally reaches your large intestine, or as we refer to it as the gut, it starts to ferment. And a process of fermentation results in a lot of gases, and it results in bloating, and it results in producing of various alcohols, including an alcohol known as methanol, which is a real poison, and it also results in increasing the size of your stools. And so people complain of bloating, people complain of flatulence, people complain of cramps after they begin consuming fiber. And in fact, if you will now run into a drugstore and buy any fiber-based laxative, and you will read a list of side effects, you will be amazed how long it is and how bad the side effects are. So it is all well known, and for this single reason, the FDA, whose sole job is to protect your health, is on the record saying you cannot, it's against the law, it is illegal to claim that fiber relieves constipation, while the majority of people consume fiber, and the sole reason for consuming it is to protect themselves from irritable bowel syndrome, to protect themselves from diverticular disease, to protect themselves from hemorrhoidal disease, and so many other conditions that affect people's gut. And actually, it's in reverse. It actually causes all those conditions because of exactly those problems I enumerated just a minute ago. Back to you, Dr. Kortney.
Wow. I said make it short. But as you can see, folks, the issue with fiber is tied up into so many things. I can't recommend enough. I'm holding in my hand Fiber Menace. You'll want to get this book. Gutsense.com or gutsense.org. Either one, I understand, works. We'll get you to the website where you'll be able to purchase it. And just read. There's so much information there by his YouTube presentations and various lectures that he's given. Please take me up on my offer to you to become very much educated, feel comfortable with Konstantine Monastyrsky and all that he has offered to you. And now let's move to what I think is, it's all wrapped up into this issue of constipation. To prevent constipation, you take the fiber, which then leads to constipation. It's just one vicious cycle. Constipation part 2. Here we go. Konstantine, here's a question I'm going to ask you. I wouldn't have made this relationship before, but I think I see how you might answer it. What's the connection between constipation and the epidemic of juvenile diabetes? Is there such a relationship? And if so, how?
Well, unfortunately, when a young child is having a constipation event, a congestivity, or hard time moving bowels, and you bring the child, a girl or boy, a very young, to a pediatrician, the immediate advice will be to take more fiber and drink more fluids. And this advice will imply that this will relieve constipation and your child will improve. Unfortunately, adults, we know that adults are having hard time processing fiber. Now imagine a 1-year-old with a very, very tiny organ, 1/10 of the organs of the digestive organs of any adult. And so when you're giving to this very young child the same amount of fiber that is routinely recommended to adults, or even half, it is still 5 to 10 times more relative to the size of this child's digestive organs vis-a-vis an adult human being. And so what happens when the child takes that fiber, it is very easy to develop an obstruction of duodenum. I'm sorry, the obstruction, yes, exactly, the obstruction of duodenum.
So just the first part of the small intestine, right at the end of the stomach.
Floating right at the end of the stomach. And duodenum is an organ which has several major organs sending out fluids, and one of those organs is pancreas, and the second one is your liver through, and so the bile duct and pancreatic duct, they end up in the duodenum, and if duodenum will get obstructed, the very first thing the child will develop is mechanical pancreatitis. And when this happens, a child will not be able, a child's blood sugar will go sky high, and parents will take the child to a hospital, and the first thing the physicians will do in a hospital, in emergency rooms, they will start administering insulin. And once they start administering insulin, insulin is essentially a substance, especially synthetic insulin, or even anything exogenous, anything that comes from outside will very quickly provoke an autoimmune reaction. And so the child is standing a very high chance of having his cells that are producing insulin, his own cells or her own cells, to actually getting damaged from that autoimmune reaction, and will become dependent on insulin injection for the rest of his or her life. And if you will look into any medical text on insulin, on diabetes 1 pathogenesis, it's written everywhere. The cause is unknown, meaning until that day, 2011, if you ask an endocrinologist what may have caused my child to have diabetes type 1, most likely they will say, well, we don't know. The cause is unknown. But in fact, it is very, very simple. I wrote about it 10 years ago in my Russian language books, and then I wrote about it in my English language books. And until this day, everybody's saying, well, the cause is unknown. But in fact, this is what the primary cause is. And another problem, a very serious one, when child begins to experience elevated blood sugar, the first symptom, quote unquote, he or she will have is thirst, dry mouth. And what usually parents will do in the situation, they will start giving the child a Coke or a Pepsi or orange juice, and this immediately will lead to a sky-high blood sugar, and the thirst will increase even more. And when the child has a sky-high blood sugar, she or he, a boy or girl, will start to urinate profusely, and then you really run into a very serious problem. You take this child to emergency room. The very first thing, the child will be administered is a blood test, and physicians will see his blood sugar sky high, and he will be put right away on IV infusions of insulin, and that's how the problem starts. And very few children recover from this, because the moment you put a child on the insulin, you then are facing a very high risk of this child having hypoglycemic episode, meaning a very low blood sugar. So the next advice is, if you have your child on insulin, you must have to give your child high carbohydrate diet, meaning diet high in sugar, so that sugar will balance out insulin. And very tiny children, 2 years old, 3 years old, they end up getting as much glucose into their bodies, as much as sugars of various kinds, carbohydrates of various kinds, as a full-size adult. And so that's the reason why most of the children, 50% of them, will die by the age of 25, and the rest may die by the age of 45, unless Dr. Bernstein, who is on the record explaining all things in exactly the same way, but not really full aware of those connections.
Never have I heard such an explanation. It's absent in any medical book I've ever seen this, but you've explained it so well. You've written about it. Medical science doesn't even know about this. They don't think this far ahead. I'm telling you, this is new. It's brand new information. Brand new information. But you make quite a case for it. Ladies and gentlemen, you just heard it first here, and I believe you have stumbled across a pretty doggone explanation that certainly gets it to be a better answer than it's unknown. I think the way you started that. Mm-hmm.
And may I add, with your permission, one more thing. And the other issue is autism. Autism is a very serious disorder. It ruins a child's life and parents' life for the rest of their lives, because essentially autistic child, and I know it's politically incorrect to say, but nevertheless, it's a very, very serious disease. Autistic child will have a tremendous amount of various problems depending on the degree of his or her condition. And so these problems will have a very high cost for a society, for a child, for a family. And and until this day, if you read most medical textbooks or go to most websites, every single one of them will say the cause unknown, we don't know why it is happening. But in fact, the cause of autism is quite well known. It is a nutritional deficiency disease. It is quite well known that there are a couple of components in human nutrition that are absolutely essential for a developing child brain. And two primary substances for this need are dietary iron and dietary iodine. And so the moment when, again, tiny children run into constipation and they're given that advice to take fiber laxatives or to increase fiber in their diet, fiber will right away cause the mechanism of action of fiber for prevention of constipation is very, very simple. It blocks the digestion of nutrients and fluids in the small intestine, and this causes a diarrhea-like state, which is essentially people perceive as a mechanism of relieving constipation. Essentially, it's a mechanical laxative. But when you block the assimilation in the small intestine of a very young child, at 2 weeks, just 2 weeks is enough for actually causing a very early stage of the autism, and 4 weeks you have a full-blown problem. And that's another thing which, again, I wrote about 5 years ago, and it is being universally ignored. I send emails to many, many people in this field, and every single one of them say, you are a freak, it cannot be so, this explanation is way too simple. If this would be too simple, we would eradicate this condition a long time ago. And so the slaughter of this, unfortunately, innocent children continues until this day because everybody's ignoring this explanation. Very simple, very logical, irrefutable, and still being ignored.
You know, that thing with the gut, I mean, there's one thing that's a common denominator to all autistic children, and that is there is a gut component in every one of them. And we only need to refer to the work of Dr. Andrew Wakefield, who I'm sure you've read his stuff, and as a pediatric gastroenterologist, found in most, if not all cases, lesions, colon lesions on colonoscopy in kids that was universal almost to all cases of autism. So the gut lesions, the colon lesions, and your explanation for how I wouldn't consider you a freak. It just might very well be a wonderful explanation. It needs further review and study, but I hope other people begin to pick up on this because they can't refute that there are gut issues in autistic kids. This is 100% rule.
Absolutely.
Your explanation is different, but they can't get around the fact this is not a unique problem in the autistic community. This is standard. This is, like I say, about 100%. Okay, we move on. Thank you very much for filling in some ideologies here that I had never thought of before. We move on. Let's take another one. How about exercise and intestinal activity? They say, is it true that regular exercise stimulates intestinal activity? This is something I find in the walkers, the maltsters, the elderly folks are doing loops around South Hills Village, a very large mall near me. They do it for a number of reasons to be healthy, but one of those reasons is to stimulate their intestinal activity. Does it?
Well, let me say this let me preface this by saying that exercise is great for every single function of your body. It's good for your mind, it's good for your heart, it's good for your spirit. Unfortunately, it does nothing for constipation. To the contrary, extensive exercise or even a moderate one may inhibit the function of the colon and it may not cause directly more constipation, but it will not relieve it. And there are two reasons for it. Number one, when you exercise, you perspire, and in the process of perspiration, you're losing a lot of salt. And the loss of salt, especially combined with a low-salt diet, causes your stools to turn very dry and dehydrated, and you will have even more problems to move your bowels once your stools become dry. And the second reason, every single physician knows that physical activity inhibits digestion and inhibits the peristalsis within the digestive tract. Otherwise, if this wouldn't be the case, and you would try to run after having a meal, you would throw up or you will have diarrhea. And so people who are consuming a lot of fluids, people who are exercising a lot with the concept that they can relieve constipation, they are actually inhibiting the function of a large intestine. And incidentally, I mean, why would moms tell to every single child that after food you have to rest, after eating you have to rest? You really cannot exercise, you cannot swim, you cannot do those things. Because the symptoms in a small child are quite apparent right away. If a child will start exercising immediately after a meal, a child will throw up or a child may have diarrhea. Adults are more tolerant because our digestive organs relative to the amount of food we are consuming are much larger. It's not as apparent, but the end result is the same. And the second very, very important issue, people are advised to consume a lot of fluids to relieve constipation with an assumption that our digestive organs are like a straight pipe. Whatever you drink will get right away into your colon and will relieve your constipation. It's actually a complete nonsense. I mean, every single iota of water that you will be consuming will get assimilated inside your bloodstream hours and hours and hours before it will never reach. I mean, if you're healthy, the water that you're drinking, the fluids that you're drinking, they're never ever reaching your large intestines, so it will have absolutely no value. Secondly, if you overconsume water, this water will essentially wash out your body from, again, salts and essential electrolytes such as calcium, magnesium, phosphorus, potassium, and so on, and that may also cause stool dryness, and once your stools become dry, they will then force you to strain, they will cause constipation, they're also behind diverticular disease, and they're behind hemorrhoidal disease.
Wow. Let's ask this question, and I think loom in the minds of many who listen to us today, and certainly loom in my mind, which is, okay, if it's clearly now, I mean, it is so clear that one should not be taking fiber to get their regularity back and to relieve constipation. Okay, tell us, what is it that you recommend in an individual who is constipated or prone to irregularity to get this colon functioning good again? What is it that you can do on the long-term basis, and what do you do on the short-term basis of someone who's constipated, feeling completely miserable? How do you relieve it?
So there are two types of constipation. One is functional constipation, is essentially something happening inside your body that prevents you from moving bowels regularly, but there is absolutely no physical damage. And then there is organic constipation, meaning when you already have some physical damage, such as distended colon or dysfunctional colon, and the dysfunctionality may be related to medications that you're taking from high blood pressure or from prostate problems or for what have you. And in those cases, you will need something more assertive. So let's talk about functional constipation, which is dominant, and it affects 95% of people. And there are really very, very simple ways to relieve it. Number one, you have to reduce the size of your stools and the volume, because if you have a very large stools and very high volume, they're very difficult to move out because the colon wasn't designed to move out large stools. It's designed for very small stools. And the way to do it is to actually reduce fiber consumption. And this will immediately, well, not immediately, it will take 3 to 4 days to reduce the size of your stool. Second one is you have to increase the amount of fat, natural fat, in your diet, because the fat is the primary stimulating factor for moving bowels. And also fat is very important for neutralizing bile, so that bile will not get into your large intestine and it will not cause all the problems it may, because it's such a tremendously astringent and taxing substance for all the organs other than the small intestine, which is well protected from the bile, from bile. Third one is salt. Salt is a primary substance that retains fluids in your stools, and if you're not consuming enough salt, if you're on a low salt diet, then you may have constipation specifically related to salt deficiency. And I know you have a physician on your show that was talking about it, and I'm not sure if he's even aware of this issue, but salt deficiency is one of the primary causes behind most people, especially older people on low salt diet, having constipation. These are 3 primary means of relieving it. Now, how do you... Oh, yes, by the way, and I forgot to say one thing. And I think I made a very serious omission even in our last show by saying fiber is the primary cause of constipation. But, you know, there is something that preceded fiber, and this is something, antibiotics. A lot of people are taking antibiotics, and especially in the last 30 years, they became quite routine. And what antibiotics do? They essentially demolish and destroy the gut flora, meaning intestinal bacteria that reside in your gut. And when we're missing those bacteria play a very important role inside your gut, and I will only talk about their role in constipation. Bacteria are essentially cells, and when they're alive or they are dead, they still they contain a lot of fluids, a lot of water, and so intestinal bacteria in a profound quality that they're generated in the intestine also allow to retain they also retain fluids, and they kind of make stools very well suitable for very easy evacuation. So once we lose those bacteria, the same way we lose salt, we reduce we reduce water retention in the stools, and the morphology of stools is not the same as it's supposed to be physiologically. And then when people start to experience passivity, irregularity, and they go to a physician, the first thing they will be recommended is actually having more fiber. But the right thing to do is not to have fiber, but to have some kind of a probiotic, be it from a yogurt, from a natural yogurt, or be it from supplement, and so the probiotic may improve, at least for a while, or temporarily may improve the status of your intestinal flora and partially solve this problem. Unfortunately, probiotics in a bottle or probiotics in yogurt, especially in the commercial yogurt, they're never the same as the flora of your stools. While healthy human colon may contain anywhere from 500 to 2,000 strains of various bacteria, unfortunately, commercial probiotics contain usually 5, 10, maybe 20 strains, and those strains are very narrow. They're not exactly the same as the ones that we have. So you have to guard yourself very carefully from taking antibiotics when there is really no need. And in most cases, if you read now in many medical texts, there is really no need on antibiotics because rushing up. And this is especially a profound case for very young children. My advice to everybody, antibiotics are very important. They play a very important role, but you really have to take them when there is a threat to your life. On a casual basis, just, to take antibiotics so you can stop a child from crying or you can go back to work faster, this is not good, and this is what will precipitate constipation, and this is what will precipitate the need for quote-unquote a natural laxative, which is fiber. Back to you, Dr. Cook.
Excellent. Let's do this. We're going to take a short break, ladies and gentlemen. By the way, if you'd like to call in to ask a question to Konstantine, feel free to do so. 412-825-6262 is the number to do it. When we return, I'm going to ask Konstantine about the use of substances, what we know to achieve bowel tolerance. And I'm going to see what he thinks about it. It's something we do frequently in the alternative world. I'd like to get a ruling on it. Wouldn't you like to know? Be back in a moment with Konstantine Monastyrsky, Constipation, Part 2.
Want to help your family eat healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing to your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Hey, good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Here on a Wednesday morning version of the show, we're at Part 2 on the issue of constipation, talking about all things to do with bowel function and elimination, how to prevent it, how to make certain that if you have it, you are able to relieve it. The expert here, Konstantine Monastyrsky, I once again point you to his website, gutsense.org or .com, either one works. And I ask you to pick up his book, Fiber Menace, which we've been talking about now for a number of weeks. As a takeoff on it, the subject of constipation has been at our fingertips now for the last show or two. As we finish it off today, Konstantine, are you with us?
Yes, I'm here.
I have a very interesting question to pose to you. As an alternatively minded doctor, we're always utilizing vitamins, minerals, herbal preparations, and it is quite common knowledge to, I'm sure, all of my listeners, as well as all the practitioners on this station, that things like vitamin C are well known to have a bowel tolerance, meaning because it's a water-soluble item, it's poorly absorbed to any great degree, that patients, when they take vitamin C, know they're going to reach a point where the stool at least loosens, and we say, oh, that's bowel tolerance for you, whatever the milligrams are, stick with it. Even a better example is the use of mag citrate or other forms of magnesium. It's a very common electrolyte that's very low, the mineral very low in most patients, the number one, I would say, of all. And so here too again, bowel tolerance rules the day, and we can literally treat two things at once. I can replace somebody's magnesium while I help deal with their issues of constipation. That's frequently a dual set of symptoms that most people bring to me. Now, with that being said, how do you feel about the use of these substances, which certainly aren't fiber? They're just not absorbed. They tend to produce the right effect. Am I advising patients correctly by that kind of a sort of a trick use of substances because they have a poor bowel tolerance?
Well, absolutely. You're absolutely correct advising patients that way, and the only objective is to make sure that whatever doses of vitamin C or magnesium they take, they're as tiny as possible, so to achieve maximum effectiveness and maximum efficiency and as fast as possible. And actually, it's very interesting, Dr. Courtney, neither vitamin C nor magnesium, they're poorly absorbed. They're absorbed very, very well. The problem that people perceive their poor absorption is because they take them when their stomach has a lot of food, and so it will take another 6 to 8 hours until their stomachs will be relieved, and before those substances will reach the duodenum or just to the small intestine and will start absorbing. So people have this perception that they're poorly absorbed. But if you take a very small dose of vitamin C on the empty stomach, it will actually have a very quick and profound effect. And also magnesium. The only problem with magnesium, there is a very well-known laxative milk of magnesia that extended use of it is toxic because magnesium accumulates in the body in the levels which your body will not be able to tolerate quite well. And in fact, some time ago, about 10 years ago, I developed a very special supplement which is called Hydra C. And Hydra C is, I refer to it as a colonic moisturizer, and it exactly does what you recommend. It provides vitamin C, but in a form that is completely, which is buffered, non-acidic. It's a derivative of calcium ascorbate, magnesium ascorbate, and potassium ascorbate. So what it does in a very small dose, it gives my clients, or my patients, or my readers, four very essential substances: vitamin C, calcium, magnesium, and potassium. So it takes care not only of all the issues related to the deficiencies of those supplements, but it also relieves constipation. But the trick is you have to, and yes, also it is an effervescent formula, so it has a very high digestibility rate. But the trick is you have to take it on empty stomach when you get up in the morning. And unfortunately, many older people, even when they get up in the morning because of gastroparesis, meaning delayed stomach emptying, their stomach is not empty, so they may take it and it will not work for it. And incidentally, I would like to remind all of your readers that all this information that we are discussing here is available on my website. It's free of charge. There is an enormous amount of information at several book sites. My second book, which is about constipation, is free of charge on my website. And every single statement that I make is referenced by mainstream sources of medical information. There is no fantasy here. It's not like I made it up. It's not based on my personal evaluation and observations of my own schools. It is all made from reading major medical textbooks and reading mainstream medical magazines, mainstream, I repeat, not alternative, mainstream, and referencing every single statement. And the reason I did this is because everything that I say, a lot of people say it's freakish, it's untrue, it's unbelievable, it cannot be so. Unfortunately, our dear listeners, it is true, and it is so, and it is confirmed by medical text. So if you are a physician or dietitian or nutritionist listening to us, please go to my website and check those references out. That it may turn not only your life, it may also turn the lives of your patients, and vice versa your life, because unfortunately, absolute majority of medical practitioners in the United States are following this a faulty dogma of fiber goodness, and they're harming their own health, they're harming health of their own children and of their own relatives and spouses and so forth. And incidentally, Dr. Courtney, you probably see it time and again that physicians, children of physicians are usually not in such a good shape as the general population, which is also my observation, because doctors are all my friends, and most of my friends are physicians, and they have tremendous amount of problems with their kids. Why? Well, because they're more proactive, because they listen more to what's considered healthy, and they do it in a more proactive, more assertive way.
Want to bring this to your attention. Maybe you don't know it. In my medical rounds, as a resident, so many times I walked into the room with the attending physician, a patient who is going to be having a procedure the following day, a gut procedure, whether that's a surgery or whether that was going to be a colonoscopy. That was a requirement on the part of the clinician that the bowel be cleansed, that the bowel be clean. And so I can recall with clarity having the nurses lay out the night before the green bottle. Now, I asked you out there if you've ever heard of the green bottle before, but the green bottle actually, it looks like a bottle of 7-Up, that colored green, yet it was mag citrate. It only 8 ounces of mag citrate. And mag citrate has been used for the bowel preparation in the olden days, I'm going to say 20 or 30 years ago, with quite great success. Unfortunately, and I don't know why they really did this, they went and switched to a substance called Go Lightly, the bowel prep, where they bring in a jug with some powder in it. It's a 1-gallon jug. You're supposed to fill it up with water. I can't tell you how many patients complained about drinking a gallon of water when all they had to do was take the 8 ounces of the green bottle. I'll give you one other thing that I mentioned to you. Patients have come to me with severe constipation, many, many days. Nothing worked. I recommended the green bottle, which no longer requires prescription. You can just walk into a pharmacy and buy it. I even understand it's no longer green. It's clear. But mag citrate has worked so well that I just can't bespeak how what a rescuer it has been for many people.
Well, the problem with mag citrate, Dr. Courtney, is that in older people it may cause kidney failure, and that's why it is now being out of favor. And PEG, polyethylene glycol, which is used in Go Lightly, is a much safer substance for this specific reason. In that concentration, in the smaller doses, mag citrate is perfectly all right, but if you take the weight for example, column prep, unfortunately there is a very high risk of kidney failure, and this was especially profound and was found out when people were prepped for colonoscopy. And so now it's out of favor, and that's why
they're going with the gallons. So age-related is the problem. Someone who's younger should be able to tolerate it.
In general, yes.
Yeah,
it's
I
age
think
and
so.
it's for diabetes, and unfortunately, a tremendous amount of people in the United States past 45, 50, specifically those people who need this prep, they're having prediabetes or diabetes. And unfortunately, when you have this condition, your kidneys are quite weak, and the mechanism of action of mag citrate is essentially what it does. It brings osmotic blood pressure in your blood very high, and colon is being used as compensating organ. The plasma is being pushed into the colon to compensate for this increase in osmotic blood pressure, and unfortunately the same osmotic blood pressure can cause kidney damage.
What is this substance in Go Lightly? What is that?
Polyethylene glycol, or it's referred to PEG. It's essentially a synthetic fiber. It blocks assimilation of fluids in the small and large intestine, and so it causes a profound movement it's like a Niagara Falls essentially. It moves fluids into your colon. It's flooded with fluids. Stools are being dissolved and they're being evacuated. The problem is you have to drink a gallon, and you have to do it on the empty stomach. And so it's very hard to drink, and then you will have a very profuse stools. And for all the people, it's very difficult to tolerate. The substance that I use, Hydra C, just 2 teaspoons, not even like levels, 2 teaspoons, and they have exactly the same effect as 8 ounces of mag citrate or as 1 gallon of polyethylene glycol.
Great. The substance is something you sell, huh?
Yes, I developed it and I provide for my clients because essentially, when you say to people, well, get off the fibers, the very first problem they run after getting off fibers, they do run in constipation because a lot of people by this stage they already have some kind of organic constipation. And incidentally, how do you determine if you have organic constipation or functional? Very, very simple. If you go to a drugstore and you buy glycerin suppository and it works on you, if you insert the glycerin suppository and in like 5 minutes from then you have profuse stools, you're perfectly fine. But if you do insert suppository and nothing happens, you just essentially move out of the suppository, you do probably have organic constipation, unfortunately.
Very excellent. We got a caller coming in. You'll take it, right, Konstantine?
Yes, absolutely.
I'm on board. You're with Konstantine Monastyrsky. What's your question? Go right ahead.
Hi. I looked on your website and read about the idea of the probiotics, which I'm familiar with. You recommended a particular brand, but you also suggested switching brands. Do you have any other brands that you think contain the appropriate type of probiotics to be effective? Or
Thank you for your call and thank you for your question. Essentially, all off-the-shelf probiotics, they contain commercial strains of bacteria that will bulk up your stool and will improve the colon function. They're not the same as the flora that is in your body, that essentially was at one point in your body naturally and unfortunately probably was decimated by the use of antibiotics. So it doesn't really matter. And I also caution people and warn people, especially older people, not to abuse probiotics because what may happen is that you may have probiotic essentially to concentrate on your small bowel, and that may cause a very serious problem in a small bowel because small bowel doesn't really tolerate excessive amount of bacteria quite well. But in general, any commercial brand from a good health store is good. And one brand that I recommend in particular, which I found out works very well for many people, is called PB8. It is available broadly, like if you go to the vitamin shop, PB8, it will work quite well. Thank you very much for your question.
Very good.
also, can you talk a little bit about what does someone do if they have chronic constipation versus functional?
Well, if you have a functional constipation, a diet is the primary way of fixing it up. As I said before, increasing salt to a tolerable normal level, to the level recommended by FDA, which is about 5 grams, no more than a teaspoon. I'm also very much against having too much salt from processed food because this will may run into problems with excessive blood pressure, with insomnia, and so forth and so on. But you still have to have salt. That's number one. Number two is fat. And I explain on my website, and this is actually not an explanation, it's not my findings, it's from any book on physiology of human nutrition. You have to have fat in your diet in order to move bowels normally. Fat is the primary stimulating substance for what is called gastrocolic reflex and peristaltic mass movement. And secondly, reducing fiber consumption, so your stools become smaller and easier to evacuate. That's what diet does. But for people who have chronic constipation, they do need some kind of a palliative. This palliative may be Hydra C that is available on my site or anything similar to that. And I provide a listing of every single palliative, which is really, let's call it by its own words, by laxative, that is available, and explain what side effects they may have, are they suitable for long-term consumption or not, and then you can just make the choice from reading this information. And Hydra C that I promote is very effective, and it's very inexpensive. It costs about $24, and it may run, if you use it properly, it may run you for 2, 3 months, 4 months or more. So essentially, that's for the same price that you're paying now for 4 boxes of fiber-rich cereal, which causes so much problems. You can, if you have a chronic constipation, you can relieve it very effectively without any damage to your health, and with some health benefits for your bones, for your immunity, for your skin, for anti-aging properties of vitamin C, with that very inexpensive substance.
Wonderful question. Thank you very much for the answer, Konstantine.
You're quite welcome.
We are coming up. We're really getting close to the end of the day. I don't want to be abruptly interrupted. I'd like to ease our way on out of here today. Our discussion with constipation is coming to a conclusion. As we do reach the point where the bongers are going to be beating, why don't you take this on out of here, Constantine? What is it that you'd like to tell us that I've been prompting so many of your responses with my questions? I'm going to let you just roll for a moment or two and bring this to the conclusion that you'd like to bring it to. Go right ahead.
Well, please don't take what we discuss here with prejudice. You've been conditioned for 20, 30 odd years to believe that fiber is a great substance, that fiber relieves constipation, that it is very effective. Again, let me remind you, according to the FDA, it is against the law to even mention the word fiber in connection to constipation. Anybody who's doing that in a persistent way to make money can actually go to jail. That's number one. Number two, fiber is a primary cause of constipation for the reasons we discuss in these programs and I explain on my website. And if you are between an age of 18 and 50, you can have all the fiber you want. You will damage your health, but it's your choice. But there are people whom you care for, very small children or people who pass 60, 70, when you be a guardian or a child or a parent, you really very often cannot make their own judgment in that regard, and you really have to help them. And I urge you to make this help by essentially going to my website, by reading tremendous amount of information out there, free of charge. My site doesn't really sell anything. You don't have to buy anything because you really don't need to do anything for not consuming fiber. In fact, you will save yourself a hell of a lot of money, and you will preserve a lot of lives, especially lives of young children. Thank you, Dr. Courtney, for giving me this opportunity to present my findings, and I hope with your help and with help of our readers, this information will become more and more known, and so it will make a tremendous impact on not only the health of our loved ones and our friends, but it will also reduce medical expenses, it will reduce misery, and it will save you a lot of money from unnecessary medical treatment. Thank you, Dr. Courtney, again.
Well, thank you so much. You were absolutely, you abound with such information that has never been available, at least from what I've been able to see, out there in any sphere, in any realm, reading, tapes, DVDs. You got it all, Constantine. I'm so thankful to have met you. We'll be bringing you back now. You can't go away and just forget it. You got to come back. Fair enough?
I'll be very happy to join your program at any time, and constipation is only one minor subset of what I do. I have tremendous amount of expertise in weight loss, in diabetes prevention, and in infertility, and in so many issues, because I'm doing this for almost 15 years, and I wrote 4 books in the process, and the constipation is just a very small subset of what I do. Thank you, Dr. Courtney. I look forward to being.
We'll bring you back and talk about one of those other areas that you have good expertise in. Until then, this is Dr. Dennis Courtney with Konstantine Monastyrsky saying thank you. Thanks to you all. See you on Friday. Bye now.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.